If in your pregnancy you ever have any worries about you or your baby, you must ring for advice, especially if it's about baby's movements. Remember, you know your baby better than anyone, and if you feel the movements are different from normal, we are here 24/7 to provide support and assess your baby's well-being. It's important that you know we are here to support and care for you with professional advice and a smile. During your pregnancy, we have the antenatal clinic on the first floor of the hospital, just next to the maternity unit, to provide you with antenatal care, including scans and high-risk monitoring. You may sometimes need the support of our team during your pregnancy to have additional scans or monitor your health and that of your baby more closely. That is delivered here at Durham, in the Pregnancy Assessment Unit, which is on Ward 10 in the maternity unit, staffed by midwives, support staff and consultants. When the time comes for you to have your baby and you need to attend the hospital, you will have already spoken to the midwives on the telephone to understand how you are at home and when is the best time to attend. Please use the main entrance, which comes off the car park. There is a drop-off zone outside of A&E, so if you come by car, you can leave the car in one of these spaces for a maximum of 20 minutes. This gives you long enough to make your way up to the labour ward and for the driver to move the car while you get settled in. The maternity unit is on the first floor, so make your way to the lift and come up to see us. We are just above A&E. When you first arrive, you will attend the Pregnancy Assessment Unit, which is on Ward 10 on the maternity unit. The midwives will meet you and assess your progress and the stage of labour you have reached to help plan your care. Wherever you are in the unit, we encourage you and your family to use the hand sanitizer as often as possible. If you are having a planned delivery, you will go straight to the labour ward, Ward 8, in the maternity reception. Please buzz at the reception to let the staff know who you are and that you have arrived. When you are moved to the labour ward, the midwives who will care for you will settle you into the room and show you the facilities. You can take lots of snacks in for you and your birthing partner, but we also will provide food to keep you fueled for your transition to being a parent. When we know you are staying with us and your partner has a car, we would ask them to please move the car out of the drop-off bays into the main car park. We hold some fantastic accreditations for our patient safety record. We have a team of highly skilled midwives to look after you and baby, as well as a full medical team for high-risk situations and interventions. Here at Durham, we've got 15 delivery rooms like this one. They are all private and ensuite. We try to keep them as homely as possible. All of our delivery rooms can be used as LDRP, labour, delivery, recovery and postnatal, which means if you are planning an early discharge, you can stay in the same room and go home from there. Our rooms are modern and spacious, and we have lots of things that can help make the rooms relaxing and support you in labour, such as light projectors and mood lighting, as well as beanbags, birthing balls and birthing chairs to keep you mobile in labour. We also have radios and docking stations to play the music you like to hear to relax or motivate you. If your pregnancy is more complex, we have state-of-the-art equipment to monitor you and your baby, including telemetry, which is cordless monitoring to help keep you as mobile as possible. We have all the pain relief you may need at all stages and levels, including a 24/7 epidural service. We have an amazing pool room, which has blackout blinds and lots of lighting, including under the water, to really make your experience special. Using water is a very effective and natural pain relief. And as you can see, it is a lovely environment and has direct access to a delivery room next door to provide all the facilities you could need. You may choose to give birth in or out of the pool, standing up, or in the room next door to the pool. Whatever position you feel most comfortable, we will support you. We have electronic notes and records in the hospitals, and this means that staff document straight onto a laptop to avoid spending loads of time writing notes, and they can input information at a single point of entry, increasing the time available to spend supporting you and your family. We welcome up to 2 birthing partners with you while you are on the delivery suite, who are very welcome to bring snacks and refreshments for you all. We do provide meals and snacks for you, but we encourage you to bring your favourite snacks to keep up your energy during labour. We're very lucky to have a theatre that's part of the labour ward, so if you needed to come into theatre for any reason, we have quick and easy access 24 hours a day. Our theatres are exclusively used for obstetric patients. The theatres are used for elective and emergency caesareans. If you are transferred to theatre in an emergency, the midwife who has been caring for you will go with you, and your birthing partner will be able to go with you, in most circumstances. As you come into theatre, you will already have met the anaesthetic team who will be looking after you. Our obstetric team of 1 or more doctors will also be looking after you during the procedure and making sure that baby is delivered safely. There'll also be midwives and healthcare assistants to assist the surgeons in the delivery of your baby. We believe whichever type of delivery you experience, it is an extremely special event, and we aim to ensure that is your experience. We would also have 1 or 2 baby doctors here as well to look after your baby once it's delivered. When your baby is born in the theatre, the team will, if possible, delay the clamping of your baby's cord to ensure baby receives all the goodness of the placenta. Then during this time, the team will lift the baby to show you and welcome them into the world. At delivery, sometimes dependent on the situation, the midwife will take the baby to the resuscitator to assess the baby and check how it is coping with arriving into this world. If the baby needs some support or the team feel the baby may be of a higher risk, the baby doctors will be at your delivery to help the baby at the time of birth. We have lots of experience in looking after babies that need support at delivery and a great team and equipment to do this. Even in theatre, if the baby is very well at the delivery, the midwife can bring your baby straight to you from the delivery and you can have immediate skin to skin. This will be so beneficial for both you and your baby. After theatre, you'll be taken into recovery accompanied by your midwife for the whole time and the theatre recovery nurse for the initial 20 minutes of your recovery. You normally stay in there for about an hour or so. You'll then be transferred directly to the postnatal ward. During that time, your birthing partner and baby would be able to be in recovery with you. We have a special care baby unit which is right at the end of the labour ward. We have 24-hour paediatric cover as well, so if we need any extra input in looking after our babies, they are there as soon as we phone them. We aim to keep our families together, even when they need some special care. Some people are admitted to the antenatal and postnatal ward before they have their baby, but most often they are admitted after they've had their baby directly from the labour ward. You will be transferred over to the postnatal ward and accompanied by your midwife. We have a variety of rooms on the ward. We have a 2-bedded bay, 4-bedded bay and single rooms. Most people are nursed in the 4-bedded bay unless there is a medical need and they could be transferred into a side room. You will be cared for by a variety of staff: midwives, healthcare assistants, maternity care assistants, baby support workers and the ward manager in the postnatal period. They will be supporting you to care for baby from feeding techniques to changing nappies in preparation for taking baby home. When you do go home, your community midwives and maternity support worker will support you with feeding, caring for your newborn and your journey as you become a family. When you are with us in active labour, you will be allowed up to 2 birthing partners to spend the entire time with you when you're in labour. It is a no visitors policy while you are on the labour ward. Once you are transferred to the postnatal ward, there are visiting policies in place there. However, we are very aware this is a special time for your family and we want you all to feel welcome as you get to know your new baby. The main aim of our unit is to be there for you and your family at this very special time in your lives. We want you to feel cared for with professionalism, experience and compassion. We are very proud of the unit that we have and we hope that you choose to have your baby here with us.